This is something we started about a month ago to try to engage with the set of issues that impact FSI on all of its dimensions, COVID and as we call it. Today, we are going to have a discussion led by Professor David Lebel, the Director of Food Security and the Environment, and the program, the REAP program, led by Scott Rozelle, will be part of it. I consider them all part of a family together. Whether REAP is independent or not, I'm looking at you, Scott Rozelle, right now. But let me just turn it over to David and to get started, and to remind you that next week, our Cyber Policy Center will be leading this discussion, same time, same place, from 1 to 2. And with that, let me turn it over to David. David, it's all you.
Thanks, Mike. Yeah, so as Mike said, FSC will be talking about some of the COVID-related work going on. We are gonna, I think, start with Marshall Burke, who is a associate professor now and a senior fellow in FSI as of a few weeks ago. And then we will move on to REAP. Both Scott and Juan Wang, who's a research scholar in REAP, will be presenting on some work they've been doing. My only role today really is to monitor the Q&A, make sure things stay on time, and then I'll be picking some of the questions to throw at them at the end. So we're gonna start with about 15-20 minutes from Marshall, and then he'll pass it on to Scott and Juan.
Great, thanks everybody. I will share some slides here. In presentation mode. Hopefully you can folks see those. David, Scott, yeah. All right. So I'm just Scott and Juan's warm-up act here. And I'm going to be talking about relationships between COVID and the economic disruptions brought by COVID and environmental outcomes. So let me start by convincing you that's actually an interesting thing to be talking about these days, which might not be obvious. So there's been a lot of, let's say, social media or news attention about the environmental changes that have associated the COVID epidemic, and in particular the economic disruptions that have been brought on by the epidemic. So easy to find on Google or in the New York Times or whatever, pictures like this. So this is a picture from a couple weeks ago in Los Angeles. It actually snowed down there. But basically one of the clearer days in LA in anyone's memory. You know, from downtown, you can clearly see the mountains and you can generate beautiful pictures like this of LA. And if you actually look in the, let's see if my slide will advance, actually look in the air quality data, this shows up pretty clearly. And I'm pulling out LA here because it normally has fairly dirty air, but you can do this for most places in the US that experience significant economic shutdowns, and you see something similar. So this is a complicated picture of the AQI, the Air Quality Index, over the years since it's been sort of carefully recorded in LA, so back to 1999. And each line here, I don't know if you can see my cursor, but as you go across the line, the redder colors indicate days or weeks of really bad air pollution. So red is bad, orange, red is like really bad, orange is like sort of bad, yellow is like sort of what you live with day in and day out in LA typically, and green is good. So this is the sort of air quality or particulate matter index below which we think, you know, we're pretty healthy. And if you look at 2020 down here, which is the bottom line, the red arrow pointing to it, since the economic disruption went in early March, we've had basically a string of uninterrupted green days, uninterrupted, very, very clean air days in LA. So this is the cleanest air, literally the cleanest air on record in LA. And again, this is not just an LA phenomenon. We can see this in most major urban areas around the US. Okay, so air quality has cleaned up. Who cares? Why should we even be talking about the environment right now in the midst of this epidemic and the economic shutdowns? Okay, here's why we should be talking about it. Number one, absent the epidemic, air pollution is one of the leading causes or risk factors for premature death in the world. So these estimates keep going up. They've gone up, they've roughly doubled in the past, I would say, 5 years as new research has come out. But leading estimates suggest that air pollution and poor air quality lead to 5 to 8 million premature deaths around the world. And this is mainly deaths of older people who are most susceptible and infants and children, right? So it typically does not kill the young and healthy, but it can kill the very young and old. But those are big numbers. So 5 to 8 million premature deaths around the world. And more important for COVID, there is emerging evidence that air pollution can actually worsen respiratory pandemics. So maybe this is intuitive. COVID is a virus that attacks first our respiratory system. It does more than that, but it's respiratory. And if we think the main channel through which air pollution worsens health is through a respiratory channel and getting these small particulates into your bloodstream, then maybe it's no surprise that air pollution could actually worsen outcomes in the COVID epidemic. So there's evidence from related coronaviruses. So SARS back in 2003, there were some papers that suggested in China, places with the worst air quality in China had twice the fatality rate from SARS than other places in China where chronic air pollution was less bad. There's a recent preprint, so working paper. The beauty of COVID now is you don't actually have to publish anything anymore. You can just put out unpeer-reviewed preprints and they get covered in the New York Times. So this is a beautiful new sort of scientific way of doing things. So this was literally covered front page of the New York Times, this preprint that came out now a couple weeks ago that again showed in US locations with higher than average air pollution, in particular PM 2.5, which is the really small particulates that can get into your bloodstream. Places with higher levels of PM had much higher, 10 to 20% higher levels of deaths in the COVID epidemic in the last few weeks. Okay, so these are what we would call cross-sectional studies. They are basically associations between long-run average air pollution exposure and short-term health outcomes, either in the earlier SARS epidemic or the earlier COVID epidemic. And so I think we should treat those as associations, not as causal. Many other things are associated with higher average pollution that can also affect outcomes in COVID or some other epidemic. So I think these research designs are not yet really allowing us to say whether this is pollution or something else correlated with pollution. But the estimates suggest this is something that merits attention. It's also a really timely question, this particular relationship between COVID and pollution, because right now and over the last couple months, the Trump administration has undertaken a number of steps to roll back regulations around air pollution and different types of key pollutants. So earlier, the plot on the right here is a Washington Post article talking about a rollback in regulation of mercury. And then more recently, they've talked more broadly about rolling back a variety of air quality regulations. And part of this has actually been in the name of reducing the economic harm caused by the COVID epidemic. So if we can, the argument is if we roll back these regulations, then firms are less burdened and they can keep producing, right? So here's an Economist article on the left here. This was just from a couple days ago. If you think a respiratory virus pandemic is a good time to cut air quality regulations, then the White House agrees with you. That's basically what they're trying to do right now. So understanding whether changes in air pollution actually affect the dynamics in the COVID epidemic and outcomes in the COVID epidemic is really important and has direct relevance for whether rolling back these regulations is a good idea or a bad idea overall. So that's what we're going to try to study. And so I'm going to try to answer 3 questions, and I'll just go through 2 of these and show you some preliminary evidence, which again, we just get to put out there as a preprint and not worry. So these are basically published in that sense. So the 3 questions we want to answer are, number 1 is really this question that getting directly at this sort of regulatory question. Do short-run changes in air pollution change anything with regard to COVID outcomes, either in terms of the number of cases that we see or in terms of the number of deaths that we see? So that's a short-run question, really. We also want to ask, does a history of long-run exposure to air pollution actually worsen COVID-related outcomes? I'm not going to talk about that today, but there's some nice new methodologies that allow us to separate these long-run exposures from all the other things that could also affect, all the other correlated things that could affect health outcomes, things like race, things like economic outcomes. So I won't talk about that, but I will talk about 1 and then 3. And this hopefully segues into the China discussion that will come next. Can we understand the additional health benefits of all this clean air that we are now enjoying? So due to the epidemic, we necessarily had to shut down our economies. One of the benefits of shutting down the economy is we reduced the transmission of the disease. One of the other benefits is that we cleaned up the air, and if the estimates that I showed you before were correct, that should have general benefits for overall health outcomes. Now, we won't be able to measure those in real time very easily, but we can use existing natural experiments that have happened in China in the last decade to try to shed some light on how big this third effect might be. So I'll just go through some quick evidence on this. So on the short run impact stuff, what we're going to do is put together data on COVID cases and COVID deaths. It turns out now the best source for this in the US is actually from the New York Times. To me, this is a little shameful that we don't go to the federal government for these numbers. We either have to go to the New York Times or Johns Hopkins. So it's either journalists or academics who are doing the best job putting this together in the US. If you go to Europe, all the national level governments have nice websites where you can pull this down. We do not. The New York Times does. So we're using case data from the New York Times, which is updated daily. It's very nice, very clean. And we have then also observations of the environment broadly and pollution particularly. And we can use those. We have observations from satellites, or we have observations from monitoring, monitoring stations on the ground. And so we can use both of those sources of information. Okay. So here's the empirical challenge. So we want to understand how short-term changes in air quality affect COVID cases. One empirical challenge is we just don't have a lot of data to work with, right? Although the last month has felt like about 6 years, it's only been a month. And halfway through that month, a lot of places put into place specific policies that are going to affect both air quality and COVID. So we have some confounds that we're really going to be worried about here. So in particular, so we want to understand, did short-term variation in air quality affect COVID cases? We have an omitted variable here, which is all the economic actions that we took, the shutdowns that we took that directly affect air quality, as I showed you before, and are meant to limit COVID cases, right? So this is an omitted variable that we need to think about carefully. So what we're going to do is try to measure as precisely as we can where and when these policies went into place. And so they're county level measures of when these happened. We are going to use data from cell phones, some actually very amazing data that these private companies are now sharing publicly with researchers that allow sort of at the county day level to understand where most people were, whether they were in their house or whether they were at businesses and how much money they were spending. And so we can try to control directly for changes in economic activity. But our main approach is going to be what's called an instrumental variable strategy. So we're going to use variation in particulates driven by random day-to-day changes in the weather. So what happens is when it rains, PM gets washed out of the atmosphere. And when various other things happen with the atmosphere, it's called the height of the boundary layer, basically, the amount of pressure above you in the atmosphere. Translates directly into sort of the experienced particulate matter on the ground. So we have some random variation in weather that we're going to use as instruments for daily particulate matter. And then we have to explore a wide range of lags. So because it takes a while for the virus to incubate in a person's body, once you have symptoms, maybe it takes a while before you get a test. Once you get tested, if you can get tested, maybe it takes a while to get that test back. So there's going to be some lag, some sort of unknown lag between when you're exposed to particulates and some downstream impact, if that impact actually happens, right? So it's not going to show up in the case data for maybe 3 days, maybe 2 weeks. We don't really know. So we have to explore sort of a wide range of plausible lags. So I'm not going to go into all the boring details here, but our preliminary finding, unpublished, even in a crappy preprint, is that even relatively small short-run increases in particulates seem to have large positive impacts on cases, again, as measured in the county level case data. So we found a 1 microgram increase, which over the last couple of months is roughly a standard deviation increase. results in about a 10 to 20% increase in cases 5 to 14 days later. So that's a pretty large effect. Again, we're trying to make sure this is not noise, but that's sort of our preliminary finding. So in terms of short run impacts, worsening air pollution appears to worsen the trajectory of the COVID epidemic. Okay, so I'm going to skip question 2, which was on the long run impacts, and I'm going to go right to question 3, and this segues then into the China work a little bit. Okay, so again, we cleaned up the air. Even absent the COVID epidemic, we think that cleaner air should improve health. How large might these effects be? Is this even something worth thinking about? So the biggest air quality changes we've seen were actually in China. And so early in January and February, there started to be some pretty impressive satellite photos published measuring changes in air pollutions, key air pollutants over China. So here's a map of January versus February 2020, and this is measuring NO2, which is a pollutant that you get from burning things, burning fossil fuels. And sort of before the shutdowns in January, you could see, high levels of this pollutant across parts of China, and then these quickly went down over the next month. This shows up in the station data as well. So here's a couple different plots. The top for my own analysis of the particulate matter monitors that the US embassies put on top of each US embassy in China. In everywhere but Beijing, we saw 20 to 30% improvements in air quality. Beijing seemed to be different actually, and there have been some nice analyses of this. Most of the steel plants did not shut down. Apparently it's cheaper for them to keep running than to shut down and then start up again. And also in places where you're using a lot of fuel for home heating, you still get a lot of NO2 or particulate matter in the air. So no effects in Beijing, but elsewhere in China, pretty large effects. And a much nicer analysis by some Chinese colleagues, this is down at the bottom here with the blue dots, found if you look across all urban areas in China, you get about a 20 to 30% improvement in air quality after the shutdown. Okay, so did that matter for any outcome that we care about? There was a very nice paper in China that looked at this earlier using the 2008 Beijing Olympics as a natural experiment. So Scott and Juan can, I'm sure, speak more to this, but what happened in Beijing is they were worried about poor air quality. You were bringing the world and the world's attention to Beijing. And so there was a huge effort on the part of local policymakers to improve air quality in Beijing, right in this window around when the Olympics were going to happen in summer 2008. So they forced many plants to shut down. They kept cars off the road. And basically what you got in June, July, August in 2008 is in Beijing and the surrounding cities, you saw about a 20 to 30% improvement in air quality for 2 months. So this is strikingly similar to what we saw under COVID. Now, COVID is different because it's a viral epidemic. So that's very important to keep in mind. But in terms of the air quality change, it was very similar. So what this earlier paper was able to do was then measure whether mortality rates changed in Beijing and surrounding places relative to other urban centers. So basically using other urban centers around China as a control where air quality did not change, as it did in Beijing. And what they found is monthly mortality rates in Beijing fell about 10 to 20%, again, concentrated among the very young and the very old, basically finding that these large air quality improvements had massive effects on mortality. Those are really, really large effects. Okay, so what we can do, and this is my last sort of calculation, and I actually blogged this out. This wasn't even a preprint. This was just even worse, a blog, and got sort of enormous press attention, surprisingly. So here's what I calculated. If you just take these folks' estimates at face value, and you can calculate under some very conservative assumptions about who was affected, that the lockdowns due to COVID in China saved an additional 50,000 lives or led to a decline in premature deaths of about 50,000. Just due to these changes in air pollution. Now, that's the air pollution effect alone. That's, of course, not the overall effect of the pandemic. The pandemic killed many people directly. There was congestion effects in the, if you had some other disease, you might not have been able to get seen. So this is the partial effect of changes in air pollution. It's not the overall effect. But that's a very, very large number, again, 50,000 people. So let me just wrap up. So why is this important? Why should we care? What did we learn? So what we knew before is that air pollution is bad for health. I think what we're learning is that air pollution probably specifically worsens outcomes in the COVID epidemic. And I think there'll be more research forthcoming on this soon, hopefully from our group as well. And second, these necessary lockdowns that we took certainly reduced COVID deaths. And they also likely had this additional benefit of reducing overall deaths because the air was cleaned up. Now, how big that effect is we can't really measure now. This is more a prediction. We can try to measure it in the future once all the mortality data are in. It's going to be actually very hard to isolate that effect. So treat this as sort of a back of the envelope calculation. Okay, but let's think about this more broadly. I mean, epidemics are a terrible way to improve environmental outcomes. This is like, we care about improvements in environmental outcomes, but this is not the way we want to do it. So the message is certainly not, wow, look at the environmental, the environmental benefits of these epidemics. Nature is recovering, right? It's a terrible way. And basically what we saw is near shutdown of our economies, or what feels like near shutdown, only led to like 20% improvements in air pollution, right? It's not like it eliminated the problem. It took it down by a fifth. We're seeing something similar in CO2 emissions. They're projected to fall 6 to 8% in 2020, which is about exactly what we're going to need every single year from here until 2030 or 2050 if we're going to meet our sort of Paris targets or Paris goals, right? So we've entirely shut down the economy, and that's led to roughly the order of magnitude CO2 reductions that we're going to need to keep the world under 2 degrees or 1.5 degrees, right? So what does that mean? I think it means a couple things. This is a hard problem. I think it has really brought home how difficult the environmental improvements that we need are to get. And getting them through an epidemic is not how we want to do it, right? We want our economies to be rolling. We want people to be back at work. But clearly what's being proposed now, rolling back regulations and allowing companies to pollute more, is definitely not the way to get started, in my opinion. So I will stop there and pass it off to Scott and Juan.
Thank you, David, and Marshall, and Roger, and Mike, and everyone. It's really our pleasure to come here today. We're going to be broadly looking at the same thing Marshall looked at, but in sort of the indirect impacts of COVID-19. And we're going to be looking at the 600 million rural residents that are around the epicenter. So we aren't going to look in Hubei or Wuhan, where by far the worst of the epidemic in China happened. We're going to be looking at the rest of the economy. And we don't need to look at the environmental impacts, since Marshall did that so well. We're going to be, of course, we're economists too, right? But economists should have bad news. We're going to be looking at good news, but we're also going to be looking at bad news. What's the economic impact, the employment impact, the education and health impacts? And it's going to be sort of the same way, good news, bad news story, and try to really sort through how this epidemic and then the measures taken to control it have affected these 600 million people that live in rural China. China's central government, right, we know really soon, January 25th, said everybody shut down, right? Shut your schools, shut your businesses, every public space, go home, shut your apartment buildings down. It was a draconian, absolute, before and after implementation of these disease control measures. Well, these rollouts just happened to coincide with China's Lunar New Year, and it's sort of good news and bad news. It would be interesting to think what would have happened if it hadn't happened during then. But at this time, right, 270 million workers who had been living in rural China but working in the cities went with their families sometimes or by themselves back to their villages. So they're all back in the villages and they're ready to celebrate New Year's, and boom, up goes the coronavirus shutdown. And so this lasts 5 or 6 weeks. By mid-March, after 5 weeks, most of the quarantine measures then slowly are lifted, except in Hubei province where they just have been lifted. And again, this is an area we aren't looking at. Of course, what's happened to those 600 million people, you probably don't know. That's because it's received very little press, little social media attention, and almost no research. You know, we saw every day during February, empty avenues, shuttered businesses, empty floors. But there were these 200 million migrant workers, their families, and then there's another 150 million what they call local off-farm workers. So they live in their village, they drive their motorbike into the county seat, work all day, and then come back. So there's almost 400 million people who are back celebrating, and suddenly they're locked in their village. And so what we really want to do is see what happened to them, right? And what happened to their employment. These are the part of the Other China, a book that's coming out pretty soon, we hope, that has a very low social safety net, no unemployment insurance, nobody's on salary, they're all hourly wages, monthly wages, and so if they're not working, they're not being paid. They aren't, this isn't the poorest of the poor, right? They're all low, there are very few people under the $2 a day poverty line, but they're very low income. Okay, and so what happened to them in this recovery? So what we really want to know is what did China do? And we're also thinking ahead, you know, as rural workers have gone back in India to their home villages, as they're going back in Nigeria and Kenya, in Cambodia, what's going to be happening to them? So what we want to do is, what did China do? Okay, and then did this control measure really help contain the spread of the virus? What was the infection rate in rural China? You know, I don't think Xi Jinping knows what the infection rate in rural China was until we published our paper. And how many people died in the countryside? But then we also want to look at the cost of these control measures. So here's our sample. This is data. So this is Hubei. We didn't collect data there, but you can see we collected data in all the provinces around Hubei. Some of our areas are almost 1,000 kilometers away from the epicenter. The epicenter is down here. Some of them are very near, right there. So, and what happens, we have 700 villages. How did we choose them? Our group, the Rural Education Action Project, in the last 3 years has done, we did big randomized control trials over hundreds of schools in each one of these provinces, in Jiangxi, Yunnan, Sichuan, Henan, Shanxi, Ningxia, on different subjects, and they were school samples. And when the 20,000 kids in Jiangxi filled out a survey form and took it home to their parents, they wrote their parents' name down and they had their phone number. And they also had their teacher's phone number. And so what we did is we have this long list of about 250,000 names and phone numbers, and we know what village they're in. We went and randomly chose 100 villages per province and called a village informant in each of those 726 villages. And they then told us what was happening in their village. Okay, and what the timing of this survey, this is a phone call survey, by the way. We didn't have a numerator. Enumerators weren't allowed to go in there. So here's the shutdown, here's first survey, here's second survey. As a matter of fact, Juan on her computer now has an April survey that we just completed on April 24th, which is a month 3. But we don't have that data to me again. So this is our survey, right? Here's Mr. Dong, and here's our enumerator. And she calls and says, we did that survey with you last year, and the teacher has okayed us to call you. The IRB at Stanford also okayed this survey, and we'd like to know a little about your village. We called 726 villages. There were maybe 5 people who refused the phone call because in February 24th, they were very bored. They were happy to talk to someone. We had, it was about a 30-minute questionnaire. There were 39 questions, and the 40th question was, would you like to tell us anything else? And our enumerators, so our enumerators right here, they kept asking us, do I have to ask that 40th question? Because these guys would often say, well, now let me tell you about what life's like here. And they would go on and on and on. And they were very forthcoming and very willing to talk about it. So what did the survey tell us? First thing is we wanted to look at the COVID-19 control measures. What happened? And you can see here, villagers weren't permitted to leave their village. Not at all. No visitors could come into the village. Not at all. No weddings, no funerals. You couldn't, you couldn't go into anybody else's home within the village. Villagers weren't permitted to even go out for walks in 72% of the, you were indoors you were indoors, and the main thing is children weren't allowed to go out. The children stayed inside for 6 weeks and never saw the outside. And this is what they look like, right? Barricading the village off. They would just set up in the middle of the street, put a banner across. Sometimes they dug trenches across their dirt roads, not letting, just to show the high level of compliance. And here says, absolutely nobody is allowed from outside. By mid-March, okay, this is week 8. Look at the fall of that. There's been a fall, quite rapidly as those rates went almost to zero in China, and there's still no weddings or funerals. There was still in some villages, but you can see the difference between February and March. We're going to be looking at the employment impacts during both February and March, and you're going to see there's going to be a difference, but it's not going to be that much. It's going to take a long time for this to recover. Face masks, you have to wear it. This is not a month into the CDC in the US finally a month in said face masks might be a good idea. Well, everyone had to wear face masks, 96% of the villages. Unfortunately, there were no face masks. And so this kept people inside and temperature checks. And you can see this is even today going in and out of villages. The village doctor, the village leader, the party committee are still monitoring flows in and out of many of the villages. That's today. At the height of it, you needed a travel pass, okay? You couldn't leave without your passport, right? That said where you should go. And basically the villagers told us they were checked every several hundred yards, several kilometers, you'd be checked many, many times. Okay, so that's what they did to control the virus, these draconian quarantine disease control measures. So this is the good news of this. What's the infection rate in these villages? 0.001%, okay? This is 10 cases per million population. So in these 726 villages, there's about 1,000 people per village. We had 700,000 residents in these villages, and 10, well, there were 8 that we had verified were controlled the virus, and they think 2 more in this one area. They didn't have any testing kits, but so 8 to 10, okay, were basically what it was. 10 cases per minute. All of the infection cases were isolated and treated in the local county, and no surveyed village, there were 0 deaths. So this is this massive rural economy around here. And look at China. So this is 10 per million in these villages. That's almost what China outside of Hubei province was, 12 per million. So what we think about, right, is that here's Wuhan and Hubei before New Year's, and people do this and sort of randomly go across China. Some places had higher infections, some had lower infections, but as you can see, right, of the 726 villages, only 720 of them had 0 infections at all. And so all the infections were no deaths. Here's the US, right? 3,000, California's 1,200. Here it's 10, okay? And so this is, the good news. News travels, people ask us a lot, and we've been giving it. Do you really believe these data? Are they trying to hide something? News travels fast in these small villages, even when people are quarantined. But this is why, if your household had a disease, okay, this is what you put on the door. Okay, this guy has an infection, right? And so I don't, that they, and of course they were trying to keep everybody else out and keep that person in. And so, we think that they're pretty, pretty accurate. And, I've been doing surveys in rural China for 30 years, and guess what? Most of the time, villagers don't lie. They even say, "How much money do you have in the bank?" And they don't want to tell you how much money they have in the bank, but they often tell you, because they just don't have that propensity to hide information. And then our informants are ordinary villagers; they're not officials. The low infection rate is, like we showed, is very much like China overall. And the disease control, this is the last thing I'm going to talk about and hand it off to Dr. Wang. Disease control coincided with the limited spread of the COVID-19 virus. There was 0 increases of cases in March. Absence the counterfactual, what would have happened out there in rural China, right? What, if we treated this like, South Carolina or Georgia, right? Or the beach in Florida, would this have spread like crazy? I don't know. There weren't a lot of seeds out there, but of course, if that had it spread a lot, local hospitals would have been overwhelmed. There was absolutely no impact, in terms of hospital capacity in these areas. They kept the curve very flat. So given the nature in other countries around the world, it's almost certain that these extreme measures to control the diseases, was responsible for a 0.001% infection rate. Okay. I just gave you the good news. I'm the director of REAP, and so I then appointed Dr. Wang, who is really the PI of this whole project, to give you the bad news. So Juan, it's all yours.
Okay, thanks Scott for the good news. Now I'm gonna bring us some bad news. First, let's look at the impact of the quarantine measures on rural employment. Basically, our survey data show that for a full month in February, nearly no one in rural China was working. Why? Because they were unable to work. The workplaces are closed. Like Marshall's slides, we saw there was not even pollution coming out from the factories. They're unable to work because public transportation had been shut down and the private cars had been mostly banned from the roads. Even if rural workers can make their way to the city, most of the time, the city landlords did not let them to rent a place to stay in the city. So with all these restrictions on individual, many rural workers also decided not to leave their villages due to fear of infection. So with all the factors combined, it's kind of not surprising to see the employment of rural workers was in social zero in February during the quarantine. And then even after the quarantine measures were lifted in March, the employment for rural workers was still low in March and April. At least half of the rural workers are still unemployed as we speak now. So that's about 300 million workers. The recovery for these unskilled rural workers is very slow. The low level of employment brings a significant shock in income. Almost every villager we talked to reported a decline in their income. Most households in a village lost 3,000 yuan per month. So this amount translates to a quarter decline of their annual income. With 300 million workers unemployed, if we do the math, then the total adds up to more than $100 billion per month just for the lost wages. So how do the rural people cope with this kind of income shock? This is a result from our March survey data. So I'm gonna take a look at the first three things here, and then I'm gonna come back with the other. It looks like more than half of the villagers are cutting back food expenditures. So literally, they're just tightening their belt to get through this hard time. And this might lead to the food and the nutrition security issues for the disadvantaged families. And we also see the reduced spending on education and healthcare. So ideally, social security system would provide a safety net to lift people up from the income shock. Unfortunately, most of the rural migrant workers are not covered by China's unemployment insurance. Though the government recently announced a relief program that is to support the vulnerable families through the impact of the COVID-19, but in our sample area, only 17% of the villagers reported the existence of such program. Right now, we don't have data on what fraction of the households within each of these villages received the relief, but even if for the families who actually received it, the amount is very low. It's 5 yuan or $70 per month in cash or in food. So what this is, there's still a long way to go for have rural workers covered under the Social Security safety net in China. And then we see that most families appear to drawing on their savings, but we also see that about 10% of the families are borrowing money from family and friends, which is a common way to cope with cash flow problems in rural China. And here we also see that 1 to 2% people choose emergency plans, such as get a loan from the bank or sell their assets. So this seems like good news, but keep in mind that this is just the beginning of the income decline. Under the stagnated economy and global recession, rural workers might reserve these emergency plans for the future. So I think it's still too early for us to know the longer term impact of the COVID-19 yet. Now let's take a closer look at the impact on education. In February and March, none of the schools in our sample was in session. So by April, now about a quarter of them had fully reopened. Most of the rural children spent at least 2 months at home. The good news, of course, is after suspending the beginning of schools for the new semester, the Ministry of Education launched an initiative to use online education to mitigate disruptions to regular schooling. Our data show that 71% of rural schools organized online classes in February. And by March, near 9 out of 10 rural students were attending online classes. And we also see a large share of teachers from rural schools were in contact with students' parents, mostly through WeChat, which is a social media app popular used in China. So every day, teacher will send a picture of assignment to students' parents, and then the students will do their assignment on a paper, and then the parents send a picture of the finished assignment back to the teacher. And then we see teacher actually grade and provide feedback to the students. So we're very glad to see these actions to mitigate the impact of school closure with online learning. However, here comes the bad news again. Our data suggests that several challenges may limit the impact of online learning. So for example, online classes were sometimes taught by local teachers, and other times students are attending online classes taught by teachers who they never met before. This might affect student learning because distance teachers are not familiar with the local students' learning ability. And during the online classes, there was limited interaction or communication between teacher and students. Although most of the students can see the video of their teachers during the class, less than 1/5 of the teachers can see the video of their students. So it's kind of like the setup we have now, where you can see me, but I can't see you. In the context of online education, especially for the primary school students, limited interaction and communication with teachers will definitely limit how much they can learn. And then the third problem here is most students in rural China get online classes through a tiny screen of a smartphone. Only about 11% of them use computers to get online. Why? Because most rural families don't have a computer. Near 60% of the rural students attended online classes through phone screens, like this boy here in the picture. So imagine this little boy are learning his math equations and English grammar through this tiny screen. And then also the internet connection is another concern. 76% of the students reported they experienced difficulties with internet during the online classes. And 1/3 of them had to go to outdoor areas for a better reception. And besides devices and internet, only half of the students in our sample could ask a question or in some way to communicate with teachers during the online classes. So although we saw huge efforts had been made across China to mitigate disruption on education, about 80 million of rural students were attending online classes. However, there were also problems for the online education, and over 80% of the villagers in our survey sample reported that prolonged school closure and home confinement during the COVID-19 had negative impact on kids' learning. We think more research is definitely needed to measure the magnitude of any learning shortfalls. Now, let's look at the impact of the quarantine measures on rural healthcare. Most villagers reported that healthcare remained accessible during and after the quarantine. Even during the quarantine in February, almost every villager were able to leave the village if they need to seek healthcare. And most of the village clinics are open daily and medicines were available. So our data show that the healthcare system was not broken down during the COVID-19 outbreak in China. This is, remember, it's probably because 99% of the villages in our sample did not have any COVID-19 infections. However, our data don't have the ability to track the quality of the healthcare though. So to summarize our findings, first we saw there's a universal compliance with the COVID-19 restrictions on movement and gathering in rural China. The good news is the virus was under control and the infection rate was very low and it did not spread in our sample areas. And the healthcare system in rural China also did not broken down. Of course, the bad news is these aggressive quarantine measures were very expensive. They caused a radical drop in rural employment. And even after the quarantine measures were lifted, the recovery for the unskilled rural workers is very slow. Widespread disruption to the rural education system, even with actions such as online education to mitigate the disruption, there was still troubling implications for rural students. So with all these findings, naturally, we would like to know what are the implications for other countries. First, China took very aggressive quarantine measures to put this virus under control. Even in individual rural villages, local government units like village doctors or party committees and so on were able to whisk away any suspected patients into quarantine. Most countries don't have this type of system, so this approach may not be feasible in other countries. One obvious lesson is that identifying infections early and implementing targeted quarantine seemed to be an effective way to limit the spread of the virus. But of course, we should also be aware that the quarantine comes with a high cost to the economy. So the trade-off should be weighted carefully. And our data also show that quarantine measures had a much bigger impact on unskilled, lower income populations. We all want to spend limited resources on those who are in need. So identifying vulnerable group is a challenge, but providing aid to these vulnerable families is important for keep them afloat during this outbreak. Another lesson is that the recovery for the low-skilled workers will be slow. So we have to prepare measures to reintegrate these workers into the economy after the outbreak. For education, moving classes online seems like a promising solution to mitigate the school closure disruption. That's why we're doing here at Stanford. But most, or in many developing countries, online education is just not possible because there is not enough infrastructure. Even in countries like China and US that have this infrastructure, there are still many challenges that may prevent students from learning online. Therefore, just relying on online education is likely to accelerate the inequality between rural students and their urban peers as they continue through school. So that's the bad news and good news we brought. Thank you.
Thanks very much, Juan and Scott. So I probably should have said this at the start. Many of you have already been submitting questions in the Q&A, and you can continue to do so for just if some of you weren't familiar with the system. So let me throw out a few questions, and then we'll take maybe, I don't know, 10 minutes to discuss things. But there are a bunch of questions coming in on, if you could speak on the China side a little bit more about the implications that you saw for like both loss of food security. Like you mentioned that people were spending a little bit less on food, but have you seen evidence of like upticks in hunger or hunger related problems? Impacts on the farm work. And I know that at this time of year, probably in February, March, there probably wasn't much to be done, but now we're coming into harvest season and a lot of like winter crops. So is that something that they're explicitly exempting? And then there is a bunch of questions about if you see any effects on homelessness and sort of just loss of income to the point where people are somehow not able to maintain their homes.
In our follow-up survey in April, we asked about, did they feel there was nutritional declines and that people were either tightening their belt so much they were hungry or having negative effects from nutritional problems. And we see there's some of that. And And remember, this is low income China. And so these guys are, most of those families have been working at $2 or $3 an hour, right? Probably bringing home, $10,000 a year. Now, they have high expenses and everything, but most of those families have savings, and they're drawing on those savings. That's what's good about being a upper middle income country. But there's still a distribution, and who we're seeing are being hurt is the lower tail, that distribution. And they definitely, I think we'll see much better as we bear down on these questions, that there are families that have just stopped eating meat. They've stopped eating fruits, small vegetables and grains. And, that's going to have effects on anemia and other micronutrient deficiencies. And that's what we're going to see. China, probably everybody has a house in China. So there's no homelessness. Rural ownership of homes is probably 98%. And so they go back to the home. They aren't always really nice, but many of them are. So there's not homelessness. The interesting thing is my colleague, Ji Kun Huang, and his group at Peking University are working on food security. So the government has not provided, as Juan showed us, almost any unemployment insurance, except for very low level, basically transfers for a few families. But they're now providing massive aid to local companies and local governments to make sure that seeds are in the ground, fertilizer is available, and that the custom plowers and custom planters are able to get out to these areas. And of course, they're worried about food for the rest of China. And so what we see in this is this real urban bias. So when we finally provide aid to the rural areas, it's to make sure they produce enough food for China. So I don't think we're going to see big food shortage. Plus, there's a lot of labor out there, and a lot of the unemployed workers have never farmed before, but they'll go help grandpa.
In a sense, I mean, a lot of countries are now getting the wave more into the sowing season or the harvest season. In some sense, they were fortunate in the timing.
Oh yeah, no, that's exactly right, because it was winter. There's a far south in Yunnan, we found a little bit of evidence. We asked this question in our survey. It was so small we didn't report it. There was a little bit of problem planting in a winter season, which in Yunnan is a spring. So
I can also add that because this outbreak happened right before the Spring Festival, so during our survey, a lot of villagers are saying they piled up all the supply for the Spring Festival. So it's like before Christmas, like on Christmas Eve, this virus came and people are not able to move, but all the food are already stored in their house. And during quarantine in February, 90% of the villagers in our sample reported that they can still go out and buy daily food. And though the fresh vegetable and fruit may not be available for a short time, but eventually all the supply was back.
So it was really an income problem, not a food availability problem.
Yeah. I think there's a lot of questions with the theme of a lot of countries that this is going to start hitting don't have the capacity. And I think part of the capacity of China was used to keep people in, but part of it was used to make sure these food supply chains kept flowing at some level. Obviously it was fortunate in terms of the harvest and sowing season, but they still had to move food around, and that still happened to some degree.
Right. So let me say one thing on that, David, is, and it's so true. If this happened in 2000 or 1995, the network of village leadership of organization at the village level would have been much more relaxed. Yes, there was a village leader. Yes, there was a party. It wasn't very well organized, and it certainly wasn't integrated to the town, to the county. In 2020, China is very organized. There is a party committee in every single village, and the party committee, as soon as this happened, the party committee was so go choose, you know, your 10 people who are going to be the enforcers, right? And we'll give them their N95. And they were given authority to get everybody back in. There's a village doctor in most every village. And the village doctor reported to the party. And so this organization, you know, sort of, I'm not sure this exists in any other country in the world. Yeah. So we've seen how hard it is here to enforce them.
Yeah, certainly. Marshall, there was I know you had started answering questions, but I think they'd be interesting for others to hear. There's obviously tons of open questions in terms of the environment and the interactions with the environment, but what's known about the mechanisms of why you'd get this interaction between air quality specifically and COVID? Is it like lung damage? Is it the particles actually providing like a vehicle for virus to persist and infect? Can you just speak a little bit about the evidence on that?
Yeah, I think it's an open question. Sorry that you guys might have the helicopter as well outside. Hopefully you can hear me. Yeah, so in the world of preprints, you can find a preprint on COVID/anything now. And there are a couple suggesting very early evidence that the coronavirus particles might actually ride on, or the coronavirus itself might ride on particles. So they filter out particles. This is in Italy actually, and then sequence basically what you get off the particulate matter filter, and they find coronavirus there. So does that mean it's more airborne than we would have thought? Can it sort of move around on certain particles? I think we don't know yet. Maybe some preliminary evidence that's the case. Seems like to me, talking to actual medical folks, so I'm a economist, but actual medical folks would suggest that, you know, it's the more likely channel is the sort of standard channel through which air pollution worsens health. This is respiratory, this is cardiovascular, especially for the small stuff that gets into your bloodstream, causes inflammation around the body, and that leads to a range of downstream negative outcomes on cardiovascular function, on cognitive function, on all sorts of things. So I think we don't know yet. It could be either one.
What do you know about, and this is just a question from myself, and I don't even know if it's well formed yet, but it seems to me when we look at sources of air pollution versus like renewable energies, investment in that has historically been quite dependent on discount rates and interest rates, right? Because there's really no fuel cost for some of these renewable technologies with low air quality impacts, but there's a lot of upfront costs. So is it plausible that the significant drop in interest rates is in this environment with all of the economic damage, that will somehow be a medium to long-term benefit for air quality and climate mitigation in general? Like, does this create the conditions that we need to meet the Paris goals and to reduce air quality, or not reduce air quality, improve air quality? Or is that such a silver lining that it's not even a real thing?
Yeah, it's a good question. I would say people are not too optimistic. I mean, what you have pushing back really hard the other way is free or negatively priced oil.
That was just one day. That was just one day.
Yeah, that was one day, right? But it was a very, it really opened people's eyes. Very cheap oil right now. So that pushes back very strongly in the other direction. So people have analyzed the sort of last, 2008, 2009 recession and concluded pretty strongly that that was terrible for overall environmental investments. Now interest rates maybe were a little bit different, but overall recessions seem to be very bad for making progress on environmental outcomes, even though you see short-term improvements in some of these outcomes themselves, right? So emissions go down, air quality improves, but these do not appear to lead to durable long-run improvements. So my guess would be that's the same here too, but yeah.
Probably depends a lot on the politicians and who's in charge of making these big investment decisions. Okay, well, I guess it's my task to just close this out. I think Mike is in the participant pool now, which means he's silenced. And so I will thank everyone for attending, and thank especially our presenters for putting the time into preparing and delivering such insightful comments and evidence. It's amazing how quickly you guys have enacted a whole set of surveys or analyses in response to these questions.